Hello everyone, Dr. PK from Dr. PK Life, and this video is about metformin. I created earlier this morning, but somehow audio was missing from half of the video, so I had to delete that and create this one again. So this is about metformin. If you or someone in your family has type 2 diabetes or prediabetes or PCOS or insulin resistance, chances are you have heard about this medication. Metformin is one of the most commonly prescribed medication worldwide. And for good reason, it's effective, affordable, and generally safe. But like any medication taken long term, there are important things you should know. Today, I'm going to explain how metformin works, its long-term benefits, possible risks, and what monitoring you should not ignore. What is metformin? Why it's prescribed? Metformin is an oral anti-diabetic medication that has been used safely for last 60 years or more. We prescribe it for type 2 diabetes, prediabetes, PCOS, insulin resistance, sometimes for weight management, fatty liver, and off-the-label use is for anti-aging. It is often the first medication started after lifestyle changes. How does this work? It works in three main ways. It reduces sugar production from the liver, improves insulin sensitivity. Your cells respond better to insulin from your body, and it reduces sugar absorption from gut. Unlike many diabetes medication, metformin does not cause low blood sugar when used alone. What are the long-term benefits? When used chronically and appropriately, metformin offers several benefits. Better blood sugar control helps keep fasting blood sugar and A1C stable over the years. Weight neutral or mild weight loss. Unlike insulin or sulfonylureas like glipizide, glyburide, it usually does not cause weight gain. Cardiovascular protection. Studies show lower heart attack and stroke risk in people using metformin. Reduced risk of some cancers. Long-term data show that there is a lower risk of colon cancer, breast cancer, and liver cancer. Possible longevity benefits. Metformin is being studied for healthy aging and lifespan extension. Common side effects for long-term use. GI symptoms, bloating, gas, loose stool, nausea. These are dose dependent and often improve with taking metformin with food if you use extended release formulation or slow dose titration. Vitamin B12 deficiency, a big one, is one of the most overlooked issues with chronic metformin use. Why does it happen? Metformin interferes with B12 absorption in the gut. Who is at risk? If you have been using it for longer than 3 to 5 years, higher doses like more than 1500 milligram per day, elderly patient, vegetarian patient. Symptoms of B12 deficiency: fatigue, tingling, numbness in hand and feet, memory issues, balance problems, anemia. These are non-specific symptoms, but people may think that, it's because of poorly controlled diabetes or it's because, fluctuation in blood sugar. But recommendation is that B12 levels should be checked every year or so. Lactic acidosis, rare but serious. This sounds scary, but let's be clear. Lactic acidosis is extremely rare, less than 10 cases per 100,000 patients per year. There's a higher risk if there's advanced kidney disease, more than moderate degree, severe liver disease, severe liver disease, or if you are chronic alcoholic, severe dehydration or sepsis. This is why the kidney function has to be monitored regularly. Kidney function and safety monitoring. Metformin itself does not damage kidney, but is it cleared by kidney? If kidney is unable to clear, it's going to accumulate in the body and cause lactic acidosis. That's the problem is. So if safe to use, if your eGFR is more than 45, you can use the full dose. If eGFR is 30 to 44, you got to have a reduced dose. eGFR less than 30, you got to avoid it. Normal eGFR is 60. So you got to have kidney function check once a year at least. More often if you have more comorbidities. Should you stay on metformin for life? Not always. Some patient they can use reduced dose. Some people even stop metformin because they have reversed their diabetes or their kidney function is kidney function has diminished and quite advanced kidney disease they have developed. In that case, it's not indicated. Now, if you maintain your normal sugar with diet, exercise, weight loss, then you don't need metformin. Others may need lifelong, and that's okay for diabetes management. The key is regular monitoring and individualized care. So metformin is one of the best, safest long-term medication we have in medicine, but chronic use requires kidney monitoring, B12 checks, attention to gut symptoms, never stop or change your dose without talking to your doctor. There are lots of internet fake gurus and there are lots of medication, lots of video there to scare the people out just to get more view. But those are wrong information being provided to people and they scare people. There's no scientific basis for that. If you have any question, ask me about it. And thank you for watching. Thank you for reposting. Sorry about the sound on my earlier video about metformin. I hope you enjoyed, and I'll see you in next video.